Hello, doctor. The October month is said as ITP month. Can you explain what is ITP?
ITP, if you expand it, it stands for immune thrombocytopenia. Previously, it used to be called immune thrombocytopenic purpura. So, what is this? So, immune is nothing but the system which is important for us to fight infections, which is we call it as resistance power in our layman language. And thrombocytopenia, a long word, big word, but it means low platelet counts. So, immune thrombocytopenia is a condition where people have low platelet counts for a particular set of reasons. So, thrombocytopenia, which is low platelets, can happen for a variety of reasons. But immune thrombocytopenia only happens when somebody has altered immune system, or we say hyperactive immune system in some ways, which doesn't attack any other part of the body, but it attacks and destroys your platelets. So why does this ITP Awareness Month make sense? As medical science has progressed, as more and more people are getting their blood tests done, we are discovering that the ITP incidence is actually a lot higher than what we thought was in India. So ITP Awareness Month is meant to raise awareness about people to a certain extent allay their anxieties, because this disorder actually can cause a lot of anxiety, if you look at the numbers on the paper. So to educate people and to make them more aware, to help us pick up more patients and try to be more aware of the disease overall.
So what are the symptoms of ITP?
That is an interesting question. So symptoms of ITP can be very varied. So some patients can have absolutely no symptoms. It ends up being what we call an incidental catch. So when we do blood tests as part of a regular health checkup, or for some other reason, sometimes we do blood tests right before a surgery to see if all the parameters are okay. Incidentally, we find that all other blood counts are okay, but just the platelet counts are low. So that is called an incidental finding, where we're not really looking for low platelets because of symptoms, but it is picked up when we do the blood counts. The other half of it is where the platelet counts are probably so low that patients are having symptoms. So as I've explained in my previous videos, platelets are cells that is part of the blood that help us in control bleeding. So it makes sure that if we get a small cut on our body, there is no, the blood doesn't continue to flow non-stop. Basically, it puts a stop to the bleeding. It also helps our wounds in scabbing over or healing. So when these platelets are low, basically there is a higher risk of bleeding. So we see patients with very low platelet counts. Usually that number tends to be below the range of 50, sometimes below the range of 30,000, present with multiple bruises or bluish patches all over their body, which has happened because of contact. There are small amounts of bleeding that happens under the skin. Patients can also have what we call petechiae, or small tiny needle-sized dots that are bright red in color, that can happen on various parts of the body. Rarely we do see patients who present with gum bleed, sometimes children especially with severe nosebleed. They can also have blood in the urine, sometimes heavy periods in women. So these are the other symptoms that patients present with. Very rarely, in about 10% of the patients, if the platelet counts are extremely less, say below 10,000, there are scenarios where patients can present with life-threatening bleed. So that can be bleed inside the brain, or we call it intracranial bleed within the skull. It can be a bleed inside the stomach, or it can be very heavy bleeding, say from the gut, or that goes out in the stools, which is rarer. But life-threatening bleeding is more common in the abdomen or in the head.
Doctor, what age group people will get this ITP?
Again, this is a multi-pronged question. ITP, it has two varieties, acute ITP and chronic ITP. Acute ITP tends to be seen more often in children, usually between the age group of 2 to 8 or 2 to 10 years of age. This is the phase when their immunity is still sort of developing and maturing. So a lot of times, we see that there is a history of either chickenpox or some viral infection or some vaccine. Less often with vaccines, more often with active viral infections, that their immune system sort of undergoes a reset and it starts attacking the platelets. This variety tends to be short-lived. We usually see it at least for over a few weeks to sometimes a few months, but most often acute ITP lasts for less than 6 months, and that is how we define acute versus chronic ITP. So when it lasts less than 6 months and the counts don't drop too low, or the counts sort of automatically reset itself with minimal treatment required only in the beginning, this is called acute ITP, and it is seen in the younger age groups. Older age group, starting beyond the age of 11, 12 years of age, all the way until your late adulthood, in your 70s, 80s, that phase is called chronic ITP. So that variety is called chronic ITP, where patients usually have persistent low platelet counts even beyond 6 months from diagnosis. Most chronic ITP patients, if their platelet counts are above 50,000, that is, if it is not too severe, they don't really qualify for any treatment. We diagnose the condition and keep them on, careful observation or wait and watch sort of a management, where we act only if the platelet counts drop below a certain count, or if those patients are having some bleeding symptoms or bleeding complications. These patients can be treated with a variety of medications, and very rarely maybe a surgery is required. So to summarize, chronic ITP is something that lasts beyond 6 months of diagnosis and requires either wakeful watching or different medications to keep the platelet counts above comfortable range.